In order to address healthcare accessibility in the United States, it requires great change starting from public policy in our local and federal governments. Due to ineffective national healthcare programs in the United States, a new and revamped healthcare program with bipartisan support must be ensured to enhance the availability and accessibility of healthcare for enrolled citizens, particularly with many mass media companies inducing healthcare into an area of contest for political control. We must change the way in which citizens view health insurance or supposed socialized medicine and overall population health. In this video, we will explore the main solutions to combating the consequences and causal factors of healthcare affordability and accessibility. First off, we need to minimize unauthorized behavior from healthcare providers who charge fees for services not received. This is possible by setting a firm definition for the request of payment by permitting transaction from the insured for only the services received and not anything that will not fall under this category. In the case of non-permitted transactions, carriers will be required and directed to fully reimburse healthcare providers for inapplicable payments. In order to alleviate these occurrences, these actions will remove the loopholes in the system that allow unauthorized behavior by healthcare providers. The first and foremost step in ensuring healthcare reform is for greater fundamental knowledge of healthcare for the citizens that are affected heavily. With no accessible and understandable clinical information present, there is no basis in their decision-making, with many patients feeling a lack of mutuality, which reduces adherence for future treatment plans. As supported by clinical professor Saini of Harvard University, it was found that 20% of elective procedures would actually be unwanted by patients if they had accessible and understandable clinical information beforehand. In addition, health insurance and coverage providers must disclose all the benefits they provide for the high premium payments. Knowing the sentiment of patients, it should be the responsibility and priority of our healthcare systems to increase transparency and produce relevant information to the public setting. To improve limited healthcare accessibility and affordability, there is a dire need to advocate for healthcare reform and allow people to acquire their right for healthcare coverage through transparency and financial support, which will be covered next. Another important method is to help expand and strengthen our nation's current healthcare programs, most notably ACA under the Healthcare and Education Reconciliation Act of 2010. There will need to be an increased availability of ACA subsidies to increase enrollment for all income brackets. This can be made possible by increasing the choice of health plans in the market and charging each appropriate rates based on those enrolled to ensure reasonable payments that won't stop their participation in welfare programs. Some challenges that may come along the way include the need to reverse previous administrative changes regarding healthcare reform to undermine the law. With a great population of low-income families not supported by government subsidies or sufficient help through their employer, there is a dire need for increased government subsidies and financial support to low-income and underprivileged households, particularly disproportionately affected minority groups. This will allow a greater percentage of low-income households to afford health coverage to receive the care necessary for sustained protection and comfort in everyday life. As part of strengthening the ACA, we need to decrease the proportion of money spent on insurance premiums. This is made possible by increasing premium tax credits for the government to cover a greater proportion of premiums. By doing so, it allows for a great population of low-income families to qualify for assistance. In addition, there needs to be change in the rules for eligibility for premium tax credits to have it be based off of family-based coverage to cover for the currently 6 million uninsured that cannot be assisted financially. When businesses explore health coverage options for employees, there needs to be greater administrative programs that oversee this process to protect those under the weak employer plans. By utilizing navigator programs in place of community-focused nonprofits, it can efficiently assist businesses to provide sufficient financial and other assistance for their employees. With increased transparency and accessible information, we hope to equip the public with a sense of literacy regarding their healthcare to improve population health. Though bipartisan support in the future, true reform can be ensured through our government and truly increase enrollment for all income brackets while charging appropriate rates. All this will require healthcare markets to comply with authorized behavior which will limit unauthorized behavior and ultimately help serve all patients impartially. Lastly, premium tax credits and their reinsurance program will allow less privileged households to gain their access to the right of healthcare by preventing rising premiums. Thank you for following along with our video.